Today we're going to be covering the urinary bladder. As always, let's start with the statements of fact. The urinary bladder governs the storage of turbid jin and ye. We've talked about other organs which have an influence on the jin and ye. The small intestine has a relationship. The small intestine has a relationship. The sanjiao has a relationship. But this is the first organ that we're talking about where it has a direct relationship with the turbid aspect. Even the large intestine is mostly in charge of conveyance and transportation through itself. The urinary bladder actually holds the turbidity. And by this we mean it holds the fluids which are meant to be evacuated from the body. Part of what this implies is that as we look at what happens when the urinary bladder goes wrong, this often comes with symptoms that resemble poorly containing or holding turbid substances, i.e. turbidity seen in the lower jiao as a whole due to the urinary bladder not correctly transforming and excreting these substances. The second statement of fact is, if the urinary bladder's qi transformation occurs, turbid fluids are exited. Our first organ connection gives some light on what we mean by the urinary bladder's qi transformation. The small intestine and the large intestine to some degree are both sending turbid fluids to the urinary bladder. The kidney yang provides heat and qi for the urinary bladder's qi transformation, which allows it to take those fluids and excrete the turbid aspect. If the kidney yang is not there to perform this function, we don't see this qi transformation occur, and this turbidity can begin to leach into other aspects of the lower jiao. When we talk about urination, a lot of different organs have to work together for this process to go correctly. While on the one hand, it's the urinary bladder's qi transformation that allows urine to be excreted, the lungs play a role with their downbearing, the heart has a direct connection through the small intestine to the urinary bladder, the liver's free flow has to be correctly participating within this, the kidney yang, as mentioned, provides qi and heat for this qi transformation to occur, the small intestine must have done a good job of separating the clear from the turbid, the gallbladder must be relatively unencumbered by dampness, or else we see an increase of turbidity seen in the cloudy urination as part of a gallbladder dampness diagnosis. And the sanjiao itself must be properly allowing fluids to move around the body for the separation and transformation and excretion to occur. When we see urinary issues, any one of these organs or multiple organs can be playing a major role in the creation of this problem in the first place. As we look at general urinary bladder pathology, the first thing is urinary issues, be that incontinence, be that urinary tract infections, be that frequent urination. All of these are indications that something, no surprise, is wrong with the urinary bladder. Second to that, we have lower jiao symptoms in general. Remember, we talked about this with the intestines. If turbidity isn't properly excreted, we see problems occurring in the jiao associated with the retention of it. Which means if we have turbidity in the lungs, we expect to see problems in the upper jiao. Which means if we have turbidity in the lungs, we expect to see problems arise in the upper jiao. If we have problems in the spleen and stomach, we expect to see more problems in the middle jiao. And if we have problems in the urinary bladder, we expect to see symptoms to show up in the lower jiao. And because in this case, we're talking specifically about turbid fluids, we're going to tend to see these problems manifest in the skin and in bloating and edema as this turbidity attempts to exit the body through another pathway. Patients who come in with skin problems exclusively below the belly button are generally a red flag that something is going wrong with the excretion of turbidity, be it through the urinary bladder or through the intestines. It's doubly a key that this is urinary bladder related if these problems involve retention of fluids, edema, swelling, anything of that nature. The last classic and common symptom that something's wrong with the urinary bladder is a tendency towards jealousy and suspicion. I don't have much to add as to the why of this, but this is noted in multiple texts that urinary bladder pathology often comes with changes to the person's mental and emotional state. I tend to think of this as a subset of the fear that the water element deals with, but you can think of it differently. I don't have much to add here. Just as with the large intestine, the urinary bladder has the ability to be invaded from the outside directly. This tends to either take the form of damp cold or damp heat, which often looks like more of a yeast infection condition with damp cold and more of a urinary tract infection with damp heat. Red rashes, weeping, grayish rashes. Those are kind of your two options here. And these are just questions of direct penetration. On the emotional side of things, being a water element, the urinary bladder is heavily affected by fear and shock. which tends to look like a sinking of qi. The effect of fear and shock on the water is most notable in children, where a sudden influence of fear will often cause them to urinate. This is a combination of the kidney and the urinary bladder both sinking downwards, not holding in fluids and allowing for the opening of the lower orifices. I think of this more as a kidney-related issue there than a urinary bladder-related issue, this being due to the kidney yang function of lifting things within the body. While not a direct effect upon the urinary bladder, excessive sexual activity will damage the kidney yang. If the kidney yang is damaged, then we lose or decrease the ability for the kidney to supply the energy necessary for the urinary bladder's qi transformation process. If that's decreased, what we tend to see is frequent urination, nocturia, or incontinence. We're mentioning this here in part because despite this being a kidney yang issue, the manifestation is in the urinary bladder. This often confuses things if patients are brought in presenting with urinary issues like incontinence. If we're not aware or we're not thinking of this working on multiple levels simultaneously, we may miss the underlying diagnosis. And just as excessive sexual activity can damage the kidney yang and create urinary problems, anything which damages the kidney yang can create urinary problems. Overwork falls into this category as well. Improper diet can fall into this category. Improper internal emotional states can cause these sorts of imbalances to arise over time. Really anything which affects the kidney yang. We only have a couple of patterns for the urinary bladder, the first of which is damp heat in the urinary bladder. With this, we tend to see frequent and urgent urination with a burning sensation at the urethra, difficulty stopping, remember, heat tends to speed things up and derange them, and relatively dark and turbid urine. In more extreme cases, there can be blood in the urine here. We're beginning to get into different territory with that. But any sort of darkening of the urine would lead you to think that there's a heat component in what's going on, and any turbidity in the urine would lead you to think that there might be a damp component. When we think of damp cold in the urinary bladder, we're looking at frequent and urgent urination, same as damp heat. But with the damp cold, we have a heaviness and a distending feeling in the pelvis and urethra. Sometimes this comes with a feeling of difficulty initiating the urination. This has difficulty stopping as well, but it's more of a dribbling and leaking than it is a painful difficulty with stopping. And here the urine's going to tend to be pale, but still turbid. Next, we have a deficient and cold urinary bladder. Often this is due to the kidney not supplying sufficient heat. Here we're still going to see frequent pale and abundant urine. We're going to see incontinence, leaking outwards. We may see bedwetting in children with this condition, tendency towards low backache, which again is going to be more the kidney yang deficiency, dizziness, more the kidney yang again. And if this is sufficiently severe, we can begin to see white discharge coming out through the urethra. If you have a patient experiencing this, make sure that they get an STD test. However, once they're cleared of any sexually transmitted diseases, we can begin approaching this as a leaking of essence case. We have acupuncture points and herbs which hold in the essence and prevent this leakage, which is often a leakage of a pure substance which we want to retain. The last symptom of this is feeling cold, which is largely due to the kidney yang deficiency. The last pathology I want to present here is one which relates to the urinary bladder but comes from other locations, and that's one of the most common presentations of urinary tract infections. The diagnosis is heart fire. The heart and small intestine, being yin-yang paired fire organs, allow the heart's fire to transmit to the small intestine. Small intestine and the urinary bladder, being tai-yang paired organs, allow the small intestine to evacuate that fire through the urinary bladder, creating a direct pathway for the heart fire to be removed from the body. When it's removed, the process of removal results in a urinary tract infection. When this is the case, it's important not to stop the urinary tract infection within a normal context, but rather to finish the evacuation of the fire. Improper or early restraining and pulling inwards of that fire will commonly result in frequent repeated urinary tract infections, or urinary tract infections which only go away while the patient is on antibiotics and then return when they stop the treatment. Formulas like Douche-San, excellent for this. That's all we have for the urinary bladder as an organ. I'll see you guys tomorrow.